Hey guys, today we will be talking about women's health. There have been a lot of questions on women's health, PCOS, and so on and so forth. So I have Dr. Shruthi Sreedhar, who's a consultant gynecologist and obstetrician, a specialized laparoscopic surgeon with us. So she will be breaking down the facts about women's health. And the first topic, what we're going to discuss is PCOS, polycystic ovarian syndrome, because I got a lot of questions about PCOS. So I thought we will have the expert with us to converse on this topic. Hello, Dr. Shruthi. What is PCOS?
PCOS, it's a polycystic ovarian syndrome, and which is commonly seen in women these days. What it does is it causes a hormonal imbalance, and because of which they come up with a series of symptoms. And the most common symptoms is irregular cycles. They can have hair growth on the face, chin, or chest. These patients will have excess weight gain. Can also have difficulties in getting pregnant.
Doctor, there are a lot of myths about PCOS. Is PCOS really that scary, or a patient should be really worried about PCOS?
So we do see a lot of scan reports saying polycystic ovaries. So when we see a report saying polycystic ovaries, it does not mean that they have a polycystic ovarian syndrome. So we only address it when they have associated symptoms like we just discussed.
What is the connection between excess hair growth on the face or anywhere in context with PCOS?
All women will have a small amount of male hormone produced in the body. That is quite normal. So what happens in PCOS patients, this male hormone will be slightly increased in quantity than a normal woman. So again, because of the increased male hormones, we do see such hair growth in a few PCOS women.
So you spoke about the symptoms of PCOS. How do you diagnose PCOS?
The diagnosis is usually a combination of symptoms and an ultrasound picture. And on ultrasound, if we see a polycystic ovarian appearance and if the patient has symptoms, then we'll probably do a blood work for the patient, especially if the patient has associated symptoms. Then we will do some hormonal test. And with all these reports, we can diagnose polycystic ovarian syndrome.
Say somebody is diagnosed with PCOS now. How do they take care of themselves?
To all the women who have been diagnosed with the polycystic ovarian syndrome, it is always diet and exercise. And 90% of the time, if they take the right diet and if they exercise regularly, most of the symptoms will be taken care of.
You said diet and exercise, right? Can you elaborate a little bit on the exercise part? Because there are a lot of confusions and myths around that part.
So for a PCOS woman or for any woman, a regular exercise, when I say regular, they have to be really consistent. And when they exercise for a minimum of 30 to 40 minutes, at least 4 times a week, it should really help them with the effects of PCOS. And it can be any form of exercise, whatever they're comfortable with.
And what about the eating habits? Like what should they focus upon and what should they avoid? Is there anything that they should avoid?
So if I'll first talk about the foods that they should avoid. There are 3 things that they should definitely avoid. First one is fried food with increased sugar, processed food or canned food. And it's always better they avoid sodas, alcohol or any other aerated drinks, anything that has maida, especially the things that you find in the bakery, red meat and a lot of butter, better to avoid.
So what are the foods or what should someone with PCOS eat to reduce the effects of PCOS?
Basically, the diet that a PCOS patient or a woman who's been diagnosed with it should take is what we are supposed to take as a part of our life. It has to be a balanced, nutritious diet, which should have a lot of vegetables and fruits on their plate. And a few vegetables that is good for a PCOS patient is cauliflower, tomatoes, broccoli, dal, and green leafy vegetables of any source is supposed to be very good. And if they like to eat meat, eggs, chicken, fish, because fish is a very good source of omega-3, all these are very good for a PCOS patient.
Okay, are there any long-term problems for PCOS?
There are definitely few long-term effects for a PCOS patient. We have seen that there are increased risk for diabetes, hypertension, cardiovascular problems, and women who don't bleed regularly, because sometimes we see they don't bleed for 6 months or 4 months at a stretch, or even sometimes they don't bleed for 1 year also. All these women are definitely at increased risk for cancer of the lining of the uterus.
So what's the connection between diabetes, hypertension, and PCOS?
Okay. So insulin is a hormone that we all have in our body, and what it does, it regulates the glucose levels in our body. So now what happens in a PCOS patient is our body does not react or does not respond to the insulin, and indirectly what happens is there's an increase in glucose levels because the insulin does not, our body does not respond to insulin, which we call it as insulin resistance. And again, when the glucose levels becomes high, they're at risk of diabetes.
Hope you found this video on PCOS informative. If you want to know more about women's health, please feel free to comment in the comment section, and we will do more discussions on that. Thank you.